some questions. All of the following are problems faced with anterior class 3 silicate cement. Nowadays nobody will ask you silicate, but yes, there had been some questions in the past. Problems faced, except silicate will have severe surface degradation for sure, marginal staining, it is not a very stable material, it will cause pulpitis, it causes pulpitis, pulpal irritation for 1 month. Advantage of silicate, very high fluoride release. It was like compared to analogous to APF gel application. Okay, so D is the not in all नहीं none होना चाहिए था actually. In question language is not good. Dr. Ayush 7 to 15 days बोला होगा, please check your notes. 7 days is an average or minimum. Okay, you check past papers also, उसमें भी question है regarding 7 days. Major advantage of using direct filling gold is exceptional marginal adaptation. See, such questions will have something related to the material, not directly what is this material. Nobody will ask, show you this and ask what is this. The following graph depicts rheological behavior of the line starting from above, stress versus strain. This is plastic, this is Newtonian, pseudoplastic, dilatant. Okay, remember this. Property increases from center radially outward. Chroma, radially, it increases. Okay, it increases. Yeah, I think the chat is moving slow again. I don't know why it happens in my case only. Right, now this is one of the favorite question in AIIMS also, in NEET also. Arrange the following shades in decreasing order of their value, means lightest to darkest or brightest to dullest. There is no word called dullest, but most dull. Okay, maximum value is of B1 in this shade guide, B1. So luckily you have one option, but still remember B1, A1, B2, A2, C1, C2. Okay, amongst these I have given you this PDF, right? What acts as an electrolyte in this reaction? Definitely between the two teeth, the electrolyte is saliva. This is a question which has been asked in exam. This image was asked in AIIMS and they asked you where this negative charge comes. The negative charge comes from the chloride ions in dentinal fluid. Okay, so to prevent galvanic shock falling scenario, what could be the solution? You have to stop the reaction between. So coating with a varnish is a good conservative approach. Root canal treatment is also good, extraction is also good, but you have to choose the best amongst the following option. That you definitely, when an examiner is giving you a tooth like this, they don't want you to extract or do root canal or do something too destructive. Okay, just keep your oral surgeon shant in your brain on the day of exam. Don't become a surgeon on the day of exam, become after it. Hardness test with two angles is Noops. With one angle 136 degree is Vickers, plus a rhomboid is shown. This we have done Brinell. Okay, this is no indentation, I'm sorry, Rockwell. Square is Vickers. Moving it fast because we already done. Type of polymer structure in the image, answer this. It is branching is seen from the parent one. Okay, branching, this is branching. The cause of discoloration is amalgam tattoo, right? This is allergic reaction to gold crowns. Yes, patient can be allergic because gold crowns are also not 100% gold. It will have some impurities. This is the best answer in this case. Now this is an interesting question. What does the color coded labeling on the liquid dispenser indicates? Anyone? Question number 15th. Question number 15th. Answer it fast. Let me check whether the chat is. Yeah, it is types of hazard. Labeling on the packages, please remember the color coding will fall into 4 categories. Blue is for the level of health hazard, red is for flammability, yellow is for chemical reactivity, white is for unique hazards. And they are rated on a scale of 0 to 4. 0 means no risk or normal substance, 4 means severe risk. Please note down if you have to. As such, this PDF will be there. So it means what? Red is 0, flammability is 0. Blue is 2, it is some moderate. Yellow is chemical reactivity is 1, it means it is very mild. The type of impression material utilized in the interproximal and subgingival areas, material which can flow between the gingival component during the impression has to be low viscosity. Okay, how it will go into the sulcus otherwise. Which of the following material is available in cake and sticks configuration impression compound? Easily identifiable, like medium fusing, low fusing. Now this question came in the exam. We had given this last year also, and this question was there in the exam last year, NEET-MDS 2023. The question was not exactly the same, but the image was same. The question was reversed. That is why I am doing these questions again with you, because exactly the same image came in 2023. A stick of inlay wax is bent into the shape of horseshoe and floated on water at room temperature. Remember, inlay wax. After 24 hours, the same wax tends to relax and distortion occurs. The distortion of wax pattern is due to all of the following: occluded air in the pattern, excessive storage time, release of trapped stresses. But the question in the exam was, a newly made wax pattern tends to change its shape and size over time. Upon cooling, it contracts and after attaining equilibrium reaches a stage of dimensional stability. Question was, what will happen after 24 hours? Will it change the shape? Will it not change the shape? And so on. Okay, you have seen 2023 paper. Identify the marked part of the wax pattern in the following. What is this part? Reservoir runner bar. Reservoir runner bar. This bar is acting as a reservoir for all the wax patterns. Main advantage of glass ionomer over composites. It's only one, it releases fluoride. Easily polished, no. Adhesive to enamel, composite is also very adhesive. Greater strength, no. Superior aesthetics, no. Falling casting defect is due to. Answer this. Question number 21. This casting defect is due to what? What are these defects actually? These are not cracks. See, it's a three-dimensional image. Try analyze. Yeah, these are fins on the surface, cracks in the investment. Rapid heating. Detached sprue at the point of attachment. Sprue has broken down. See, I'll just erase it. Okay, this is due to what? This is primarily due to improper sprue angle. Following equipment used in laboratory. This is a centrifugal casting machine. This is a centrifugal casting machine. Again, the torch flame used for different melting of different metals. Like, they can ask you even about what is acetylene flame, what are the uses of that. Okay. Black coated noble metal alloy casting results from. You are doing a casting of a noble metal and there is black coating. Black coating can be because of sulfur contamination and oxidation. Surface irregularity on the cavity side. Only one porosity, that is back pressure porosity. We have done this image. Incomplete casting, rounded margins and shiny appearance. Incomplete wax elimination. We have done this. Now this is a good question. What should be the direction of handpiece to achieve the most rapid abrasive action of the burr? While doing a crown prep, you know the burr is rotating clockwise. So have the maximum advantage of cutting or the abrasion, you should move the handpiece in the opposite direction. You should move it in the opposite direction. That will achieve the maximum cutting efficiency of the diamond abrasive. Right? Opposite. Yes, Dr. Niyati. The following concept of hard particle abrasion is used in hard particle. See, the hard particle abrasion is used in air abrasion. This is the image of air abrasion. Abrasion is used in industry for finishing of materials like sandblasting is hard body particle abrasion. Okay. Then they can give you conditioner, primer, adhesive, etchant, 3-step. This is 4th generation. We have just done this in the images. Apart from amalgam, which material can be used for class 5? Class 5 we can use composite, GIC, RMGIC. Remember class 5, what is the reason of class 5? It can be due to abrasion, toothbrush abrasion. In abrasion, material of choice is composite. It can be due to abfraction. Material of choice is microfilled composite. Okay. Then there is due to erosion, chemical wear. Erosion can be stable erosion, unstable erosion. Stable erosion, material of choice is RMGIC. Unstable material of choice is again composite. Right? Advantage of layering technique: minimizes the C factor. Minimizes the C factor. C factor का the thing given in your cons endo most important MCQs का PDF, or you can say Dr. Varun's lecture. Please follow that. Okay, not the one given in Student. What must be the film thickness of ideal film thickness of a luting cement? It's 25 microns. Okay, and this is majorly fulfilled by zinc phosphate. Minimum film thickness is shown by zinc phosphate. Maxine is shown by resin cement. What makes a seating a crown easier? Low viscosity cements, more taper will enhance seating, decreased height will enhance seating. Not a very good question, but just how much you should load your cement, not more than 50%. Okay, because more cement means more flash and it will create problem. Removal of flash or excess cement after luting for cements which show true chemical adhesion or cement which show mechanical bonding. True chemical adhesion after initial set. Mechanical bonding like zinc phosphate as fast as possible. This is ulta, sorry. As fast as possible and after initial set. Yes, Dr. Saurabh. Class 2 and class 5 have maximum C factor as given in your most important. अच्छा इसमें नहीं है. I think I can show you. I don't know where it is. अभी इस लैपटॉप में नहीं है. The reaction between zinc oxide and phosphoric acid is exothermic. What can be done to dissipate the heat? There are methods. Okay, number one is you cool the glass slab, that is the best. Divide it into multiple increments. Mix each increment for 15 seconds. Okay, spatulate each increment for 15 before adding another. This is correct. Use most of the area, spread it along the area. Increase the mixing time, powder liquid ratio are the worst options. Dr. Saurabh, both will not come. Follow that. Okay. और अगर आ ही जाए ना, worst case scenario 2 and 5, choose 2. String test 12 to 19, the cement is considered a string, can be lifted. It is for ideal cement for cementing a processes. Ideal for cementing a processes. Crazed surface, this question came. This is a repeat. Crazed surface on glass ionomer restorations may result from. This is crazing of GIC. Inadequate protection of the material during maturation stage of GIC. For first 5 minutes, you have to protect your GIC from water contamination. How you do? The best method is apply varnish. If not there, then apply sterile petroleum jelly. What you apply is Vaseline. The Vaseline is a brand name, but the actual product is sterile petroleum jelly. Advantage of using pre-proportion capsules for amalgam. No need of trituration. Wrong. Prevent evaporation of the mercury. Correct. Prevents amalgam tattoo. Wrong. Okay. Identify the appearance. See, this is the difference. Okay, this is a properly triturated and this is over triturated. I have given you a good description and this is under triturated. Under is dry crumbly mask which keeps on breaking. It is dry, it is crumbly and it is dull mix. Okay, you cannot pack it. Normal mix is you can make it into a ball. The ball will not break. Both will have shiny surface. Okay, this question came in AIIMS with all 3 images like AIIMS few years back. Difference between these two is important. normal mix and over triturated mix. Normal mix will be also a ball, over triturated will also be a ball, but normal will have a convex outer surface. This will have a flattened outer surface. You can easily appreciate. I'll remove these. Okay, now you can appreciate it. Plus over will be more luster, more shiny. See, you can say more shiny when you have two things in comparison. You cannot, if I give you only this, you cannot say it is shiny or not. Okay, flattened top surface, convex top surface or outer surface of the ball. Third is over trituration will be having higher temperature. It will be hotter than the normal mix. So you remember these. Type of dental implant. See the framework type of it is subperiosteal. You have lifted the flap beneath the periosteum. This is your periosteum. The entire band is periosteum. And you place a framework, stabilize it, and then suture it. Okay. This is subperiosteal. Indications for mini implants. Important and good question. Mini implants are not only used in orthodontics for anchorage, can also be used in overdenture retention and anchoring temporary prosthesis. Important MCQ. Okay. When the shade matching of composite is done in a dry state, important question. It would make the tooth appear. When the tooth is dry, it will be lighter than the adjacent tooth. Lighter, brighter actually. Okay. Same is like for etched tooth surface. Okay, when you do etching, it shows white frosty appearance. Okay, whiteness increases. Agent used to provide barrier against passage of irritant. You mean chemical barrier. It is varnish. We have three protective measures: varnish, liner, base. It is against chemical protection. It is chemical plus mechanical, chemical plus mechanical plus thermal. Thickness is in microns, usually 200 to 400 microns. Less than is equal to 0.5 mm thickness. Important. More than is equal to 0.75 mm thickness. Again important. Okay. Varnish. You apply 2 coats usually because it contains volatile solvents in natural resins or rosins. Liner is majorly we are using calcium hydroxide because of its very good properties, antibacterial, pH, thickness and all that. Theoretically we can use MTA also, same properties, but setting time is 2 hours 45 minutes. That's why we are not using it. Base we can use of anything. Underneath composite we don't use ZOE. We use GIC base, that is called sandwich technique. Sandwich technique is indicated in class 2, class 5. That is the cavities which are near the gingiva. Also in class 2 the caries which is below the contact point. Right? Now this is also a good question. What happens to the depth of etchant when concentration higher than 50% phosphoric acid is used? It decreases. It will not have that impact. Okay. Glazing agent is applied. This question has also come in your exam, PYQs. You can remember the name OptiGlaze. This is applied after doing a composite restoration. For what purpose? It improves the surface smoothness and improves the aesthetics. Okay. Now this is one thing we just added. What are Richmond and Davis crowns? They are post type porcelain crowns, which like crowns which have an casted post along with it, the casting. Okay. In 1870, Richmond crown was introduced with a threaded tube incorporated with the root canal screw retained crown for grossly decayed single tooth. It was used. Yeah, DCPM is formed. Most effective agent for removing smear layer while retaining the dentinal plug. That means what? They are talking about self-etching primers. Polyacrylic acids. Polyacrylic acid. Right? That is enough for TM images. Okay. सो जाओ या पढ़ाई कर लो, don't waste time. But yes, before that, do check your NBE account. Again, I'm telling you, there are many students, I don't know, but they have forgotten to edit the form. They were supposed to do editing during the edit window, but don't do this mistake. If your photograph, signature and thumbprint is not proper, you won't be allowed in the exam. Right? Chalo, thank you.